Members of the media, the country head of AstraZeneca, Praveen ji, it's a pleasure here because it's a great moment for us here in the state of Goa, just like Mr. Praveen mentioned, that AstraZeneca, it was because of AstraZeneca and this partnership with QRA that we were able to, along with the health services and government of Goa, that we were able to take this initiative forward. Initially, when this came forward, we didn't understand as to what is the type of impact that will have on the people and the population in the state of Goa. Actually, all of us know that the government of India and with the visionary leadership of our Prime Minister, we have been trying to see how, and if you look at the budget today that has been presented, if you look at the stress that has been given on healthcare, AI has got a tremendous also role to play on utilization of artificial intelligence to see that we are able to diagnosis is more accurate, time is reduced, and we are able to take this forward in a very different way. Basically, when we talk of different type of reformative kind of healthcare systems putting in place, AI here in the state of Goa, I think Mr. Praveen has just mentioned, it is their partnership of AstraZeneca with the state government that helped us bring QRAI on board and take this forward. Today, we have been in a position to carry out X-rays and chest X-ray and check them for lung cancer. I think we have already completed 1,01,000 and odd screenings done of X-ray, which is one of the, it's a big sizable amount. And Goa is one of the first states in the country to initiate this and take it forward. Those small pilots have been done by them in different parts, but we were just discussing how do you basically enhance it and take it to a niche and a level higher. Actually, I'm very happy with this partnership. And I would like the media and all the doctors have been a part of it. I would like to congratulate them also for all their hard work, because it is their contribution and also our contribution and partnership with them to take this forward. It has been really very successful. We have also targeted that we will complete more than 2 lakh X-ray screening for using artificial intelligence in trying to check more than 2 lakh X-rays in the state of Goa by 2026 end. Actually, when we talk about this, it not only identifies cases of lung cancer, but we are also, in this whole pilot that we have done in the state of Goa, we have been able to identify about 10,500 nodules. Then apart from that, we have been trying to see that it's been helping in reducing time for diagnosis. All this has been a very important system, further building a robust health system so that we are able to response time, to give the treatment or identify the patient and take it forward has been really very remarkable. Lung cancer is one of the leading causes for mortality, and as a result of which early detection and everywhere. Actually, I have already moved a file. Actually, I don't know whether our team has mentioned, Prasela must have mentioned to you, Dr. Rajendra Desai is also there. They must have mentioned is that we want to notify in every hospital that along with what we have done is with every X-ray that is taken out of a chest X-ray, this automatically by default, this screening utilization of AI and this combination is used so that we are able to accurately diagnose the patient and bring it forward. If it requires any additional care and we need to take it forward. It is important and unique that this scanning that we have been doing and this utilization of AI in the true sense, we are moving forward. But I was just told the platform that QRAI is to offer is much more than only on lung cancer, but on several other parameters. But here today, like Dr. Satish Matpikar has just mentioned, and on the occasion of the Cancer Day and several other initiatives that are being taken by the state government, this initiative is very important for us. So I would like to assure the country head of AstraZeneca, Mr. Praveen, is that the state government would love to further enhance and take this partnership to a different level. It is important for us, along with QRAI and along with your support, the state government will be in a better position to actually create a broad spectrum partnership as far as utilization of AI is concerned. This particular program has been implemented across different centers. Today, from the 9th to the 20th, we have also identified different primary health centers and community health centers so that this scanning and screening can be done and go more in an intense manner so that we are able to provide early care and identify these type of problems among the people so that we can take it forward. It is important for us that the AI that I was just mentioning, that right up about 10,556 nodules, including 1,600 classified high-risk enabling cases to enable clinicians to prioritize the patients and take urgent health care, whatever protocol needs to be followed. Today, in the state of Goa, which is also known as a very progressive state. And we have been doing these things with partners like AstraZeneca. We all know about the credibility and the credentials of AstraZeneca. We have also got a partner in QRAI. We want to do this and take this forward. This compact event here today, and I'm happy to have interact. I'll be interacting with them to see what best we can do and how we can take Goa and make Goa a model state across the country. Many times when we have been doing this, you have seen on other screening programs also the Government of India. Recently also I just mentioned to the Government of India of what we are doing and how we are doing. Today also we are having somebody who is directly concerned officer who is directly reporting to the PMO on what we are actually doing in the state of Goa, how we are utilizing, how we are through partnership with AstraZeneca and QRAI, how we are actually utilization of AI in the area of diagnostics and healthcare and how it is impacting the lives of the patient. It is important for us to see that we move forward. Today, I would just like to mention that 18 confirmed lung cancer diagnosis is reduced the average time to diagnose these patients by more than 50%. Now, all this, which is there in shortcut, what I would mention to you is that the thrust that has been given by the Government of India of utilization of AI and what role of AI is going to be in the future. And Goa would like to lead the way. And I've already said many times when I was speaking in the assembly also that we would like to do everything that is possible to utilize AI as a tool of diagnostics and take it forward in a very different way and make Goa a diagnostic hub and lead the way in the country to show what all can be done by utilization of AI. We are a very small state. The impact can be felt on the patient's life immediately. Also, the load on the doctor and the doctor's diagnosis and accuracy can be also, can be much more. And this is how we want to lead the way. I'm grateful to AstraZeneca and also to QRAI, for having supported the state government and our state government officials, all the doctors, because without the doctors, this is something that is not practically possible to achieve. And all the doctors and all the healthcare assistants and all the people dealing with healthcare and all the technicians who are there who are helping us actually take this forward. I would like the media to actually take this message across as to what Goa has been doing. All the media from here locally as to what the state government wants to do. And state government wants to actually expand this and take it to a different level altogether. And I think with this we'll be able to save more lives. Ultimately, our objective is to see that we are able to see that this cancer, lung cancer, which leads to mortality, that we are able to reduce this mortality by early detection and proper, accurate checking and assessing of the patient from time to time. And across the state, we are going to implement this. Today, we are implementing it between 19, 20, in about 18 centers. We will make sure that we are able to scale this up to a different level so that we are able to, have this program on a regular basis and take it and increase and cover up the population that is required. I'm very happy today to be here, and this is something which is very important for us, and this is something that is very important and which has been highlighted in the budget also. Highlighted in the budget in a manner in which I was just actually going through in detail. Actually, yesterday I was talking to somebody and I was just going through in detail that every aspect Honorable Prime Minister Modi ji has actually through every aspect, he has ensured that healthcare verticals can be utilized in different ways, in different segments. And I think we should make use of it. Goa is going to lead the way. Goa will ensure that we are able to take AI and this partnership forward, and QRAI and along with AstraZeneca and the Health Department and Health Services in the state of Goa, we will make sure that this partnership moves a long way and Goa will become a model state in the country for utilization of AI, and especially in detection of these or lung cancers. And also we want to make it, basically I was suggesting that it should be notified in such a manner that all these chest x-rays by default we are able to, and I want to be the first state to actually have this notified so that the doctors by default ensure that we do these scannings in a very meticulous manner so that we are able to identify issues and save lives of people. This is a complex disease, which is lung cancer, is something which is very difficult and tough for families. And when we have a mechanism like this in place, I think we need to scale it up, and we will scale it up. Thank you so much.
This we come to the end of a formal function. We are now opening it up to the press for a Q&A session.